The Scottsdale Veterinary Clinic presents professional dental cleaning for your dog and cat. The first step is a pre-dental exam. The pre-dental exam is a physical examination. The eyes, the nose, the ears, as well as the mouth are inspected. In addition, the abdomen, the legs, the lymph nodes, the skin, and the coat are also inspected. As well as listening to the heart, the lungs, and recording temperature and weight. The next step is a preoperative antibiotic injection. A preoperative antibiotic injection is given to prevent infection due to the bacteria that's released from the plaque during the scaling of the teeth. Placing the IV catheter. The catheter area is first shaved. An IV catheter is inserted, which allows for rapid and direct distribution of medications and fluids during the dental procedure. A blood sample is taken. A blood sample is taken for the pre-operative blood evaluation. The preoperative blood evaluation. The preoperative blood evaluation is used to evaluate the functions of the liver and the kidneys, electrolyte levels, and blood counts to ensure anesthesia is catered to your pet's medical conditions. The preoperative blood evaluation is performed here in the Scottsdale Veterinary Clinic using state-of-the-art equipment. Sedation and pain injection. Sedation decreases preoperative anxiety and pain during the procedure and relaxes them in preparation for anesthesia induction. Anesthesia induction. Anesthesia injections are then given via the catheter to induce sedation. An endotracheal tube is placed in the throat to administer inhalant anesthesia and to maintain respiration during the procedure. Pulse oximetry and anesthesia monitoring. This assists in monitoring the heart rate and oxygen saturation while under anesthesia. A technician trained in anesthesia will also be with your pet at all times to monitor the temperature, heart rate, respiratory rate, blood pressure, and EKG. IV fluid therapy. IV fluids help maintain hydration and blood pressure during the dental cleaning. Temperature management system. The use of heating pads, warming tables, blankets, and warm water bottles keep your pet warm and comfortable while under anesthesia. Ultrasonic scaling. A high-powered instrument supplying high-frequency vibrations is used to remove plaque, bacteria, and calculus from the teeth. Subgingival curettage. Subgingival curettage is the removal of calculus and plaque found on the tooth below the gum line. Probing for pockets and gingival recession. Probing is done to measure pocket depth around a tooth and check for exposure of root surface to establish periodontitis and periodontal pockets and determine if x-rays and extractions may be necessary. Irrigate. Irrigation is the flushing of the mouth to remove loosened plaque and bacteria from dental surfaces. Dental X-ray. After probing, an X-ray may be taken to determine whether extractions are necessary due to bone loss and tooth decay, and to identify open root canals and infected tooth roots. The X-rays are then processed, and they're immediately available to be viewed by the veterinarian. The next step is to polish. The purpose of polishing is to smooth the surface after the scaling of the teeth. This decreases the adhesive ability of plaque in the future. The next step is a fluoride treatment. Fluoride is an anti-plaque treatment that's used to strengthen and desensitize teeth and to discourage the development of future plaque. It's now time for recovery. A technician will monitor your pet after anesthesia until they are awake with the ability to stand up and has recovered swallowing reflexes. IV catheter removal. The IV catheter remains in place until your pet's ready to be discharged. A pressure bandage is placed to prevent bleeding and is usually ready to be removed 15 to 20 minutes after. Dental charting. The doctor and technician will complete a detailed medical chart after the procedure along with home care instructions. The technician will call you to arrange a pickup time after your pet is awake from anesthesia. Home and dental aftercare. The technician will go over any home care instructions and questions that you may have. And we also send home a list of recommended preventative care techniques to help keep your pet's teeth clean and plaque-free. Thank you for watching this dental care video from the Scottsdale Veterinary Clinic.